Welcome back. Many people with COPD don't recognize the symptoms and wait before seeing a doctor. This makes treating COPD more difficult and increases people's risk from dying from COPD. Becky Wozniak is still here. Thanks for staying with us, Becky.
Thank you.
Let's talk about common COPD symptoms for a little bit. Can you enlighten our viewers on what that looks like?
Absolutely. One of the biggest symptoms that people complain of is a chronic cough. And chronic just means that that cough has lasted for weeks or even months and just doesn't go away. Oftentimes that cough can be associated with sputum or phlegm that you're coughing up. It's also shortness of breath, feeling just like you can't catch your breath, doing the regular activities that you normally do and just finding that you can't do them as you could before. You may notice that your lips start to look a little bit blue, or even your fingernail beds start to look a little bit blue. That's also a sign of COPD.
Those sound like very serious symptoms to me. Why do you think people put off seeking help?
You know, a lot of people don't actually recognize it as COPD. A lot of people think that it's just aging, that they're just getting short of breath, or that they're just out of shape. So they don't recognize it for what it is. And as we mentioned earlier, a lot of people downplay their symptoms and they almost feel embarrassed, especially if, longtime smokers, they know that smoking leads to lung disease, and they sometimes feel as though it's their own fault and they're embarrassed to seek help.
So we know that people experiencing these symptoms should go see their doctor. So how do you as a provider know, or anyone for that matter, know if it's COPD or asthma? How do you differentiate those symptoms?
Well, I talk a lot with my patients. I want to talk to them about their symptoms, how long they've had their symptoms, what exactly their symptoms are. I want to get a good history on maybe what exposures they've had, and then we can do a few tests to check for COPD. One of the first tests that we're going to do is what's called spirometry, and this is where the patient blows into a big machine and we can measure how much air they're getting in their lungs, how much air they're blowing out of their lungs, and how quickly they're able to do that. That gives us a good idea as to whether this is COPD or asthma or another condition.
So briefly earlier you mentioned chronic bronchitis and emphysema. So can you talk a little bit more about each of these and the symptoms of the two?
Sure. So like I said, emphysema is when the lung sacs, the little air sacs that are deep in your lungs, they tend to get larger and they actually break. And they can cause air trapping. So this makes it very hard for patients to take in a big breath. They can't get new fresh air in because air is trapped in the bottoms of their lungs. So these patients do feel quite short of breath pretty frequently. Whereas chronic bronchitis is very similar to asthma. These patients might notice a wheeze or a whistle when they're breathing, and they just have a very difficult time getting air out and in as those airways are inflamed and restricted.
So how does somebody know the difference between chronic bronchitis and acute bronchitis? What's the difference?
Sure. So acute bronchitis, this is something almost always associated with a cold, and it lasts, for a few days or even a week or two. You go to the doctor, oftentimes you get antibiotics, and this goes away. It goes away very quickly, whereas chronic bronchitis lasts for months or even years.
Can people get emphysema and chronic bronchitis at the same time?
Yes. In fact, most people with COPD do have both, which makes COPD such a difficult disease because it's a lot of lung issues, and that's why it's very hard to breathe.
So if someone gets diagnosed with COPD, and then what's next? What are the treatment options?
So there's a variety of treatments depending on their symptoms. We may want to consider something such as pulmonary rehab. We can also, there's a variety of medications that we can use to treat COPD.
Great. So we're going to talk more about treatment options here in a few minutes. But is treatment determined by how severe COPD is, or how does a patient know which treatment option is right for them?
Yeah, so it's important to speak to your doctor and be very honest about your symptoms. It's important not to downplay those symptoms because COPD is progressive. We want to slow that progression down, and the treatments are based on how severe the symptoms are. And so it's important to get on the right medication is letting your doctor know what exactly you're experiencing, and that will help your doctor choose the right treatment for you.
That makes total sense. So can you talk about the stages of COPD? Are there stages?
There are stages. Yeah. The first stage oftentimes is patients don't really notice they have it. They might just have that chronic cough that we spoke about, or very mild shortness of breath. These patients can function very normally and live their lives, and a lot of patients don't know at this point that they have COPD. And that can progress much further to the point where patients are very debilitated on oxygen, and some even have tracheostomies or other ventilators and things to help them breathe.
So one last question before we have to take a quick break, and that is, can COPD be cured?
It cannot be cured, but it can be managed. So the lung damage that happens from COPD is permanent. We can't fix it, but we can slow that progression, like I said, and we can manage it so that it doesn't get to the point of being fatal.
Awesome, excellent. Well, thank you for that information. We're going to take a quick break, and so I hope you'll stay with us.
Yes, thanks.
We need to pause here for a quick break. After the break, we'll dig deeper into treatment options and how to live with COPD. Please don't go away.